In this video lecture, I will be talking on musculoskeletal autoimmune disorders. The musculoskeletal system is as vital to life as any organ system because of its essential roles in movement, mechanical support, and mineral homeostasis. The immune system attacks the tissues in the joint and muscles, and this may result in inflammation, pain, swelling, and eventually muscle, joint, and bone damage and deformities. I will just give some examples for some autoimmune disorders associated with musculoskeletal system and associated with HLA. For example, ankylosing spondylitis. It is common. The common association is the locus or the subtype B27 in HLA class 1. Post-gonococcal arthritis associated with B27, acute anterior uveitis associated with B27, rheumatoid arthritis associated with DR4, chronic active hepatitis associated with DR3, primary Sjogren syndrome associated with DR3, and some autoimmune diseases related to musculoskeletal system. For example, systemic lupus erythematosus. It is characterized by the presence of autoantibodies to nuclear antigens. Nearly all patients with SLE experience joint problems, and in SLE the most common musculoskeletal presenting complaints are arthralgia, myalgia, myopathy, arthritis. The typical lesion being a non-erosive synovitis with little deformity, in contrast to rheumatoid arthritis, where the lesion is erosive synovitis. Soft tissues in patient with SLE get swollen, and this is quite common. And also patients with SLE will present with effusion in the joint, for example knee joint. When they occur, usually they are mild, but however they may persist for long. And also rheumatoid arthritis, it affects the musculoskeletal system, and in this disorder T helper 1 cells attack antigens. Actually it is not fully known, but it could be type 2 collagen in the synovium in the joint, producing tumor necrosis factor alpha, with resulting inflammation and damage to the joint. And as can be seen here, these are small joints in case of rheumatoid arthritis, and this is a normal joint where cells, T cell, B cell, and other cells, granulocytes and other cells, they are strictly forbidden to come and to sit here. But however, during abnormal condition, for example when there is a trigger, inflammation or trauma or some infections, these cells, they come and sit here. They enter the joint and lead to hyperplasia of the synovium, as can be seen here, with destruction of the cartilage and the bone. And the key cytokines are TNF alpha, interleukin number 12. These released by the migratory macrophages, and interferon gamma. They come from T helper 1 cells. And also during normal apoptosis, or as a physiological process, these cells invading the joint, they die actually by apoptosis. So they release citrullinated peptides, which may be, or which may get engulfed by antigen presenting cell here in the joint, or migrated to the joint actually, because they should not be here, and this present them to T helper 1 activate B cell here and activate T helper 2, and this will lead to production of citrullinated peptide antibodies, which interact with the citrullinated peptides, and this will lead to activation of the complement, which will lead to inflammation. And also in case of Reiter syndrome, which is an autoimmune response to gastrointestinal or genitourinary infection. So patients with Reiter syndrome may come with genitourinary tract symptoms, conjunctivitis, and asymmetrical arthritis. Actually, symmetrical arthritis occurs after infection and usually in form of inflammation of the joints and tendon attachments as the joints. And Reiter syndrome is T cell disease. So the pathophysiology of this disorder is mediated by T cell, which is activated by bacteria. T cells mistakenly attack some joints, and it will lead to this inflammation. So this Reiter also it linked to the presence of the human leukocyte antigen B27 epitope. In case of Sjogren syndrome, which is an autoimmune disorder affecting usually salivary gland and lacrimal gland, musculoskeletal system may be involved. And as you may know that Sjogren syndrome is characterized by dry mouth and dry eye. So the condition often accompanies other immune system disorders, for example, rheumatoid arthritis and lupus. So patients with Sjogren may have one or more of these: arthralgia, arthritis, myopathy, morning stiffness, prolonged fatigue, and these are related to musculoskeletal system. Inflammatory myopathies or muscle disease, which are autoimmune disorder, and since the concern of this lecture is musculoskeletal, so we are going to show different types of inflammatory myopathies. So inflammatory myopathies include heterogeneous disorders characterized by inflammation of mainly the skeletal muscles, which are probably immunological mediated. So there are maybe 4 types, but I will here mention these 3 types. It is dermatomyositis, and as can be from here, there is an involvement of the skin. So the involvement of the myositis is bilaterally asymmetrical, affects the proximal muscle first, and the pathophysiology, uh, it is due to antibodies and complement deposited in capillaries, and this deposition actually occurs prior to inflammation, and B cells and CD4 cells are present within the muscle. And in the skin also there is actually some coloration in the face, maybe lily coloration of the skin of the face. Polymyositis, it is actually the affected skeletal muscles. It is bilaterally symmetrical, affects the proximal muscles first, and it is due to cell-mediated immune responses to muscle cells or to myocytes. But however, CD8 or T cytotoxic cells and macrophages are present near damaged muscle fibers, and antinuclear antibodies are positive in some cases. Inclusion, the third type is of myopathies of myocytes is inclusion body myocytes, and here the lesion is asymmetrical with involvement of distal muscles, extensors of the knee and flexors of the wrist and finger, and the pathophysiology is due to CD8 or T cytotoxic T cells, so they are found in the muscle. Also in this autoimmune disorder, which is Scleroderma, there is an involvement of the musculoskeletal system. And Scleroderma, as you may know, that is an autoimmune disease that causes inflammation and fibrosis, which is thickening in the skin and other tissue through the body. So common symptoms include painful symmetrical arthropathy, joint swelling and loss of mobility, morning stiffness, and muscles swellings. And now I will show some examples of antibody-mediated muscle diseases or diseases of musculoskeletal system. For example, in case of type 2, which is antibody mediated, and I will give example, very famous example. It is acute rheumatic fever, and it is due to cross reactivity. These antibodies, as can be seen here, race primarily against streptococci, but due to similarity between protein on the wall of streptococci and wall of the heart, these antibodies will kill the streptococci, but however they come and sit here and cross react with the wall of the heart, and this will lead to carditis, pericarditis actually, and the patient may present with together with fever and other symptoms and signs, so they may come with fleeting arthritis. Fleeting arthritis, it means migratory arthritis from one joint to another, and it usually affects big joints in contrast to rheumatoid arthritis. Also, an example of type 2 hypersensitivity that may affect musculoskeletal system is Myasthenia gravis. And as can be seen here, this is nerve endings, and these are the vesicles containing acetylcholine. And in a normal condition, These are the acetylcholine receptors. So this acetylcholine will come and it binds acetylcholine receptors, and this will lead to action potential or the movement. However, in some patients may mount or upregulate antibodies against acetylcholine, and these antibodies will come and sit here and interfere with the binding of acetylcholine, and this will lead actually to muscle weakness and temporal. Actually, here the paralysis in common, it is not permanent. It is temporal paralysis, as these antibodies actually they move away, and this will give a chance for acetylcholine to work. And I will give an example of hypersensitive reaction type 3, or example of immune complex mediated hypersensitivity that affect the musculoskeletal system. For example, SLE, it is an immune complex disorder. It is the antigen here is DNA, nucleoproteins, and others. And actually, the disease may manifest by nephritis, arthritis, and vasculitis. Also, reactive arthritis, it is due to Yersinia bacterial antigens, and the patient may, following infection, present with acute arthritis. In case of serum sickness, as the injection of the serum may contain non-human ingredients. For example, if it is raised in horse, may contain some proteins from the horse, and the human may produce antibodies, and these antibodies, when they bind to this foreign or non-self proteins, this will lead to activation of the complement. So the patient, in case of serum sickness following vaccination, may present with arthritis, vasculitis, and may be nephritis in very severe condition. And examples of type 4 hypersensitive reaction that may affect or involve the musculoskeletal system is known as T cell mediated hypersensitivity. Actually, this is multiple sclerosis, and it is, as can be seen here, due to demyelination of the nerves at the central level. So, target for pathogenic T cells, protein antigens in central nervous system. It is myelin basic protein, and proteolipid protein. So this will lead to or attack by these T cells, maybe following viral infection and other factors. This will lead to demyelination in CNS with very vascular inflammation, paralysis, ocular lesion. Also, rheumatoid arthritis, it could be type 4, and here it is due to cell-mediated immunity. It could be also be type 3, and as I mentioned, that the citrulline antibodies or anti-CCP, when they interact with citrulline peptides, this will lead to immune complex mediated disease and will lead to activation of the complement. However, rheumatoid arthritis also could be type 4 hypersensitive reaction, and this will affect the musculoskeletal system. And as I mentioned before, that the antigen is not actually fully known, but it could be type 2 collagen here. And here actually in type 4 it is mediated by cells, and it is cell-mediated immunity, and this will lead to chronic arthritis, inflammation, and destruction of articular cartilage and bone, as can be seen here. Example of hypersensitive reaction type 4 or T cell mediated hypersensitivity that affect the musculoskeletal disorder is peripheral neuropathy or Guillain-Barré syndrome. Actually, here there is destruction of the myelin sheaths of the peripheral nerve. As can be seen here, these are the peripheral nerve, these are myelin sheaths. It gets distracted by the, as can be seen here, cell-mediated immunity, and through these inflammatory or pro-inflammatory cytokines, and this will lead to neuritis and maybe weakness and paralysis, but late, not early enough. And as you know that now the treatment for this condition is easy. It is through intravenous immunoglobulin and plasma pheresis. Thank you very much, Professor Ahmed Bolad.